We're talking the pharmacology of IV.
I said, well, let's see how we say that. Acetaminophen. Acetaminophen.
Let's all just agree to call it Tylenol. IV Tylenol is actually a great drug. I remember the first time I gave it, but I was taking care of a patient who had a femur fracture, which we all know is an exquisitely painful experience for the patient. And I went and asked the ER doctor, hey, can I get an order for some pain meds to give to our patient over here with the femur? He said, yeah, sure, give a gram of IV Tylenol. And I said, are you a heartless monster? You want me to give this guy Tylenol for his broken femur? And he said, Gwenny, just trust me. Just try the gram of IV Tylenol and see how he's doing in like 20 minutes. If he's still having a lot of pain, I'll give you a narcotic. I go and give the patient the gram of IV acetaminophen, and wouldn't you know, the patient actually experienced a surprisingly amount of pain relief, and I couldn't believe it. And I've since become a huge fan of giving IV acetaminophen. I did go back to the doctor and I said, I'm really sorry I called you a butt munch under my breath when I was pulling it out of the pyxis. I didn't think it would work. We know that the mechanism of action of acetaminophen is that it inhibits the synthesis or the production of prostaglandins. And those are, think of those as the chemical mediators of the pain experience by acting on the cyclooxygenase pathways in the central nervous system. Acetaminophen is not an NSAID like ibuprofen, Aleve, some of those other medications. We do know that acetaminophen is metabolized by the liver, so we've got to be super careful if we're giving this to our liver patients. Now, when we give it PO, we give the patient a pill, there's always going to be a first pass metabolism, and so very little of it becomes bioavailable. However, when we give it IV, there's 100% immediate bioavailability. And for reasons that are beyond me and I couldn't find in the literature, was that it does work really well for patients, especially patients with orthopedic injuries. They love to use IV Tylenol in the post-op setting. There's a couple reasons that I love using this as an adjunct for pain control. Number one, it reduces the amount of opioids that I have to give my patients. Whether it's someone who says, hey, I'm however many years clean, I don't want any narcotics, I have a past history of abusing them. Absolutely, I want to support my patient in that, but I also want to control their pain. So if we can give them something like IV Tylenol, especially if they're NPO because they're getting ready to go to the OR or what have you, this can be a great option. Additionally, especially in my elderly patients, look, I don't trust them any further than I can sling a piano not to go apneic on me when I give an elderly patient, say, fentanyl or morphine. So sometimes we are able to give this IV Tylenol, so hopefully we don't have to give them an opioid analgesic, or maybe we could just give them a little sniff of fentanyl with some IV Tylenol, and that'll be enough to control their pain. I know. I've heard your argument, but it's so expensive. No, it's not. You used to be right. IV Tylenol used to be cost prohibitive, but that was when it was in its first 10 years of development. Anytime a drug company develops a new drug and they get FDA approval, they automatically get a 10-year patent on that medication to try to make back the money that they spent in developing that drug. However, at the end of that 10-year period, it's open season that anybody can make a generic version of it, and then those medications get way, way cheaper. And that's exactly what happened with Ofirmev, or the brand name of IV Tylenol. I did a quick Google search of a medical supplier, and it's only about $50 for a 1-gram dose, which is nothing compared to half the medications we give. And for our dosing, we usually give 1 gram over 15 minutes as needed, but no more often than once every 6 hours. Of course, we know that the daily limit for acetaminophen for adult patients with a healthy functioning liver is 4 grams. So be careful. We, of course, never want to overdose our patients on this, but does your shop use IV Tylenol?